I think there's two things. One is, at least from a physical therapy standpoint, I can speak to specifically, is that when you come into our clinic, you see one therapist and one therapist only, each and every time. And we try to adopt that same philosophy with the other providers in the clinic. That way we can establish a good rapport and continuity with our patient care.
How long is a typical appointment at MIPM?
Most appointments are 45 minutes. I'd say the average patient spends about 8 to 10, maybe 8 to 12 visits here, at least in physical therapy. Establishing the proper diagnosis is key. I think that a multidisciplinary approach to the patient care is also an important element. But from my standpoint, I look at how can we give the patient tools to take care of themselves after they leave us as a patient, after they're done with the therapy, after they're done with their stay here. So that involves giving them proper knowledge of their condition, activity modification in their daily life and work life to keep themselves healthy, exercise including stretching and strengthening, just the overall knowledge to be able to take what they've done in here and be able to carry that through to take care of themselves beyond their care here. I've been doing this for, I'm going to date myself here, 38 years, and I still get a lot of satisfaction of helping people get to a point where they never thought they could be in terms of their recovery. Circumstances may be different. There may have been some barriers in your life that kept you from getting better 6 months before. It could have been something personal, it could have been something work related, something could have changed in your status, and it could be a different approach to your therapy may have needed to be taken. The best thing, number one, is to identify what you've done to overuse it. And number two, rest on that particular time. There's other circumstances where the stretching and light exercise is the exact remedy to get rid of your pain. I want every patient to no longer need our services. That's my ultimate goal. And a big part of that is doing their home exercises. But when you come in here, we just don't repeat your home exercises. What we do in here is typically things that you cannot do at home.
Is there a difference in physical therapy and the chiropractor, or do I still need to see both?
I think the multidisciplinary approach is important in most patients' care. Some of the things that we do in physical therapy that are typically not done in chiropractic care is looking at things like strength and balance and flexibility and addressing those things through proper exercise.
Thank you for your time today, Mitch.
Yeah, you're welcome. Thank you.